Hello, and welcome to the Smart Injury Doctors Podcast, the injury market's top program for doctors, lawyers, and insurers who want to gain greater insight on how to improve patient recovery results and deliver better services in the U.S. injury market. Please welcome your host, Dr. Jeffrey Allen Kronk.
Hello, doctors. The topic today is, can you determine the severity and location of a ligament injury without an excessive motion test? Absolutely not. You cannot tell today how badly injured the ligaments are unless you have an excessive motion test. I've said on other podcasts before, look, there's two imaging biomarkers for ligament injuries. Imaging biomarker is a thing that's found on an image that leads to a definitive diagnosis. Definitive would be what everybody would agree with. So a fracture is a imaging biomarker. So if somebody sees a fracture of the femur on an x-ray, everyone will agree the femur is fractured. And what you want in the injury market is agreement, right? It's an adversarial market. You have insurers that are contesting that the patient was injured. You have defense attorneys that are contesting the patient was injured. You have plaintiff attorneys that are contesting the patient was injured. People are reviewing your documentation, and it can get kind of crazy as an injury provider, right? Your job should be, hey, I take serious conditions and I minimize them so that the patient has no problems either now or into the future with this injury. And I'm very, very good at it. And I provide documentation that allows anybody who is in the benefits process to be able to determine the benefits that the patient has the right to have. That's your job as a doctor. Now, in the medical legal aspect, where you have these adversarial parties around you, consensus is the key. Providing things that provide consensus is the key. So an imaging biomarker creates consensus. It creates agreement, not disagreement. So in the ligament assessment area, there are two imaging biomarkers. So there's 220 specialized ligaments that hold the spine together. 23 of those are discs. If you've got a disc herniation, you pick it up on MRI. That's one imaging biomarker. So you can't have a disc herniation without an image of the herniated disc on the MRI. But that is not the most problematic ligament injury. The most problematic ligament injury is excessive motion. And excessive motion is picked up on stress radiology and accurately measuring for the intersegmental motion. That's done with a computer. At the company that I'm a CEO of, Spinal Kinetics, we trademarked our process called CRMA, Computerized Radiographic Mensuration Analysis. And the reason why we trademarked that term is because we didn't want to be known with any other system that's out there. What it makes us unique as a company is we have 2 board-certified medical radiologists that perform this service on each and every test. And our company strives to do this the most accurate as it can possibly be done in the market today. That's what we strive to do. We use a proprietary system that was developed for Spinal Kinetics. So when you have a ligament injury, the first thing that should be checked for is excessive motion, because the ligaments, when damaged, allow the joints to show up with excessive motion. And how much excessive motion and where it is determines the severity and location of the condition. Now, that also hones you in on where you should be focusing your treatment. It's very, very simple. If I have an injury, a patient comes in and they have an auto injury, right? They're in a whiplash type injury. We know the mechanism of injury. Injuries are the derangements. Mechanism is a force delivery system. In this case, force delivery system is auto collision. Now, if the spine is going to derange or damage or injure, it's got 3 patterns. You can break it, in which case that's really bad if it interrupts soft tissue, or the 2 ligament findings, which are disc herniation or excessive motion. Now, excessive motion you're going to test for right away. Now, there are those out there that say, hey, you have to wait to let pain and inflammation reside before you can do an intersegmental motion test. If your patient can bend their head forward and can bend their head backwards, you can do an excessive motion test. Pain and restricted movement or range of motion means that the patient's not going to be able to move their head forward. They're not going to be able to move their head back. Obviously, you cannot do an intersegmental motion test then. You would have to wait, do some treatment, get some range of motion back, get some pain and inflammation resolved, and then take the stress radiology and do the stress testing with accurate mensuration, with accurate measurements of the intersegmental motion. And remember, intersegmental motion is two forms of motion. There's translation motion, the back and forth movement of the vertebra on top of another. And then there's the angulation movement, and that's the angular pattern when the patient goes into flexion or in the lumbar spine and extension. And to determine how normal or how abnormal these vertebral bodies now angulate. You can have excessive motion due to excessive angulation. So when you have a ligament injury, the first thing you're going to do is test for excessive motion, because that's what tells you you have a grade 1, grade 2, grade 3 spine sprain. It also helps you clinically correlate ligament laxity. It helps you clinically correlate, do you have a spinal instability? So if I've got a deltoid muscle test, and I went and I checked the deltoid and I've got a grade 4, I know I have a C5 nerve problem. Now the C5 comes out of the C4, C5 motion unit. So I would want to do stress radiology and accurate measurements to see if I've got excessive motion at 4 and 5. If I got excessive motion at 4 and 5 with a motor problem, I basically have a spinal instability. And that's consistent with the damage that would be consistent with the mechanism of an auto collision. Right now, if I did a pinwheel on the same thing and I did the C5 dermatome and C5 nerve problem again, C4, C5 motion unit, I need to see exactly what the ligaments are doing as far as holding that motion unit. Is there any problems? Now, if I had abnormal motion in that motion unit, especially if I had an extension, then it's quite sensitive for the fact that I probably would have a disc herniation associated with that, depending on the clinical scenario of the patient. So it's very easy once you start to understand ligament testing. Once a doctor understands ligament testing, they would never be without it, because prior to ligament testing with stress radiology, you're absolutely blind. No doctor can tell you how badly damaged those ligaments are. No doctor can tell you, is it grade 1, grade 2, grade 3 sprain? You can't clinically correlate for spinal instability. You can't tell the severity of the spinal instability. Nobody can tell that without imaging. And this spinal instability is the number one cause of pain and disability in the world today. So doctors have to get a lot better at doing these types of testing, at doing this type of testing and understanding what you're doing with it. The market is dying for providers that standardly can do what I just said, and then can apply great treatment, apply great outcome assessment procedures so that you know when the patient is actually done with care. This process is really simple, but without excessive motion testing, you cannot determine the severity and location of a ligament injury. Anybody that says you can, I challenge to say, okay, how? How? So doctors, if you're not familiar with excessive motion testing, you need to get familiar with it, because it's the only way you accurately diagnose a spinal ligament injury. And these patients in this market today, and the employers in the market, and even the insurers in the market, everyone deserves to have accurate diagnosis so that they can get very cost-effective treatment. These patients need to get to the right doctors right away so that you can get on with the correct treatment, applying the correct treatment program, and getting great results that minimize the patient's future benefit need, therefore saving everybody in the market. But it starts with an accurate diagnosis, and without excessive motion testing on a spinal ligament injury, you can't determine, you don't have the whole picture. No doctor does. Doctors, that's the point that I wanted to make on today's program. Again, if you're not familiar with excessive motion testing, go out to www.thespinalkinetics.com and get registered with Spinal Kinetics. Get the information on what you need to know for excessive motion testing, and start doing a better job with diagnostics than maybe what you are today. I know when I started doing excessive motion testing back in my practice in 1995, it completely changed my professional career. It changed my understanding of what the patient had. It changed how I managed the patient. I got better results, much better results, because I now had more targeted treatment. I understood the underlying injury. And when you do that, you will get much better results. So doctors, thank you very much for your attention on this brief podcast today. As I always say, put your comments down below. Also, if you have things in your professional life right now where you're trying to grow an injury practice, but you've got challenges, whatever those challenges are, let me know. Put it in a comment down below, and that's what I'll have future podcasts on. Doctors, I very much so appreciate what you do every day for patients throughout the country. I'm with you on that, and I thank you very much, and I look forward to having you on the next podcast. Thank you very much.
You've been listening to the Smart Injury Doctors Podcast, the #1 audio production show for professionals in the U.S. injury market that want to deliver better injury services to the patients, clients, or insureds they serve. If you like what you heard today, please leave us a review and don't forget to join us on our next program.